All right, this is video number 2. So this is just kind of hodgepodge, so it's not organized in any particular way. What I learned was the 10-year risk of when we calculate ASCVD using the risk calculators, etc. The 10-year risk doesn't mean much in a lot of patients, and we'll get it, and it's like 2%, 5%, etc. And we really can't convince our patients to do anything. It's like, well, hey, my risk is 2%. That's pretty low, right? Over and over again, there is one lecture. A couple of guys were like, use the lifetime risk. So look at the lifetime risk, because when you use these calculators, it'll give you the lifetime risk, and it'll be 40%, 50%, etc. And that's much better at predicting cardiovascular risk disease. And so, hey, you know what? Your lifetime risk is 60%, 70% versus 8% in the next 10 years. So especially for our younger patients, I mean, if you got a 40, 50-year-old, I mean, who the hell really cares about the next 10 years? I mean, we really want to know their lifetime risk. So this is very, very important. Another thing, so older patients, they have severe thyroid cancer. So, when the older patients do get cancer, I mean, it's more aggressive and it's really harder to treat. Just keep that in mind. PCOS with obesity. So if you got an obese patient, they need a GTT. So we're missing a lot of diabetes just checking an A1C. I'm not sure what the mechanism or why, but if you got PCOS patient with obesity, get a GTT. Another reminder, pioglitazone reduced bone density. So we're using a lot of in patients with Medicare, because of the cost. And so remember, watch the BMD in these female patients. There's a study for metformin, to see if it extends life, and it's ongoing actually. So we'll see what the results are. Gynecomastia, if you got somebody, you got to get an ultrasound of the testicles. Okay, so just keep that in mind. So Remidex, we use a fair amount of Remidex in a lot of these guys, and so remember that it'll make sexual symptoms worse. So it'll lower estrogen, as we know, because it's a estrogen blocker, but you need estrogen for sexual function. So this is probably one of the biggest things I learned as well. So it was just an aha moment for the whole lecture. It was worth the 1 hour talk. Bar soap versus lotion soap. So there's something going on. So moisturizer, conditioner in the liquid soap that blocks the absorption of testosterone. So the soap creates a film which avoids absorption of the androgel or the topical testosterone that we use. So because we see these patients all the time, we put them on testosterone, and the testosterone doesn't change. And so think about this. So ask your patients, or even before you put them on it, hey, make sure that you're use a bar soap and avoid moisturizer or conditioners inside the soap. So radioactive iodine, for younger women with Graves, to avoid PTU, methimazole, during pregnancy later. So if they're in their teens or early 20s, and want to have kids a couple of years down the road, or they're getting married in a couple of years, think about radioactive iodine, because we don't want to go through methimazole and PTU and all this stuff when they get pregnant later. So just so push for radioactive iodine. And this is just anecdotal. Just this past week, I saw several older patients who went into spontaneous AFib. One guy was in remission of their thyroid, and then one patient was on methimazole, and TFTs were perfect, and on for 6 to 8 months, and all of a sudden they went into AFib. So again, spontaneous AFib with these older patients with Graves, you might want to consider radioactive iodine as well. Antithyroid drugs, you want to keep the lowest dose possible during pregnancy, and if they go in on antithyroid medications and they get pregnant, consider stopping it early, because these patients will go into remission in the early pregnancy while pregnant. So monitor them closely. You may want to consider lowering the dose.